Hey, this is Dr. Evans, and today's topic is going to be on should you get balloon sinuplasty. So for those who don't know, balloon sinuplasty is a procedure that I do here in the office very frequently, about 4 to 5 times a month. And the procedure is for chronic sinus problems, and it helps people to get less sinus infections, to breathe better, and to have less sinus pressure and drainage in their face. So is this something that you should consider? So there's really two main groups of people who I think benefit from this procedure. So the first group of people are people with what's called chronic sinusitis. So this is people who have had symptoms of sinus infections and sinus problems for at least 3 months, and they've been receiving antibiotics, allergy medicines, nasal sprays, and all of these things, and it's either not really helping, or it maybe helps a little bit temporarily, and then a few weeks later everything comes right back again. So those are people who should consider a procedure like balloon sinuplasty. The other main group of people are people with what's called recurrent sinusitis. And the typical story with this is people several times a year are getting sinus infections. And in between those infections, they may feel fine for a few months, but the problem keeps coming back over and over and over again. And typically we're talking about at least 3 or 4 times a year or more. So those are kind of the main two groups of people who should consider having this procedure. And again, both of those groups will have probably tried different medicines, whether it be antibiotics, allergy medicines, sinus rinses, sometimes allergy shots or drops as well. And all of these things aren't really helping, and the problem just keeps going on. So balloon sinuplasty, I think, is a great first procedure option for people in these situations. It's nice in that we do it in the office. Typically people are only in the office for about 1 hour in total from the time they arrive to the time they leave. And the actual procedure portion of that only takes about 10 to 15 minutes most of the time. So if this is something that you're having problems with, I'd be happy to evaluate you. We can look in your nose in the office, see what's going on structurally inside of your nose. I also have a machine here that does CT scans in the office. So we can kind of do one-stop shopping for sinus patients, where you can get a full evaluation in one visit, and then we can find the right plan for you going forward. So if this sounds like something you're interested in, I would encourage you to come see me. You can also pick up a copy of my book, The Sinus Solution. This talks a lot about chronic sinus problems and the different options for treatment, including balloon sinuplasty. So I hope everyone has a great day, and we'll talk to you soon.